Hi, ladies. We are so excited to talk to you today about stopping the diagnosis dance and getting to the root cause of your back and hip discomfort.
This is super exciting because so many of the women that we work with feel like they've been on a hamster wheel playing a game of whack-a-mole of one back or hip issue after another. And they're going maybe from doctor to doctor, or they're avoiding doctors altogether because they don't want all the spot treatments. If that is you, and if you would like to get to the root cause of all of the back and hip stuff in one fell swoop, stay tuned and keep listening.
Yeah, so today we're going to do a little bit deeper dive on some of the other diagnoses specifically that we talked about, just to familiarize you with the anatomy and why these things are connected.
And a little bit just reviewing how it feels. So you can go, oh yeah, that's me. I did have that during my pregnancy. And so this applies to you if you have had this in the past or if you're having it now, because it's a sign that something underneath is not functioning optimally.
Yes.
Okay, so sciatica is a big one that many women end up with during a particular pregnancy, maybe first, second, or third, or afterwards at some point. Sciatica, all that is an irritation at some point in the nerve's path of the big giant nerve that starts from the lower lumbar segments. Let's tap into my favorite picture here. The lower lumbar segments would be right here. That's your low back on top of these. And then it also, in the sciatic nerve, is also made up of the top three nerve roots of the tailbone, the nerve roots that escape these little holes. And then the sciatic nerve dives deep down through your glutes and then runs down the back of your thigh and then sends little branches to supply your whole leg all the way down to your toes with muscle power and sensation. So I don't really think it's a stretch. I don't have to really convince you of why this nerve could be a problem or be irritated through pregnancy as the pelvis is stretching, or recovery when your core doesn't quite turn back on, or when the uterus is moving up and down and all around and growing and shrinking. That nerve passes right through the hip and pelvis in the middle of all this. So it's very common for that to be irritated.
And so that's dormant glutes, where your glutes have kicked off, your pelvic floor is overstretched and weak. So again, we're bringing it back to these are the root causes of eventually the irritation of that nerve. Unless you've had a previous injury specific to that area, then that's a different ball of wax.
Correct. The sciatic nerve can be irritated at any point along its path, where the nerve root comes out, as it travels through the glutes, as it travels down the leg, as it passes through the pelvic bowl, because it has to get to your leg. So the next thing, piriformis syndrome, very much related to sciatic nerve. That's the deep hip muscle. Now, this is a view from the front, but the piriformis is on the back. It goes from the side of your tailbone over to here, the leg. So it's a deep glute muscle, and the sciatic nerve dives through the glutes right either in front or behind or in the middle of your piriformis muscle. So it's basically a pain in your butt. It's a persistent spasm of this muscle. It's an irritation of that nerve as it passes by that muscle. And the piriformis gets overactive because of an imbalance in all that deep core support musculature, which is what we love to help you fix.
So what I have found with the women who have been dealing with piriformis syndrome is those are the women with the really weak pelvic floors. They've lost that connection. And so the hip rotators, the piriformis is a part of that, has had to really take over some of the duties of the pelvic floor to help support them in movement. And it's not meant to do that. So when these other muscles are trying to help and come on board, it sometimes is the littlest thing that you do that is kind of the straw that breaks the camel's back, so to speak.
A lot of times, all the diagnostic words we're using today are things that happen, feel like they come on all of the sudden. And that's what women come into and say, why? I've done this exercise 100 times. I was just lifting the baby the same way I had done a million times before. Why now is this thing hurting all of a sudden? I can't get it to stop. And as Jen said, it's the straw that broke the camel's back. The dysfunction was being set up. The imbalances were being set up for potentially years before there was pain, because our bodies are great at workarounds for us, which is such a gift until it's not.
Yes. Until it tips in the opposite direction.
What's another common diagnosis we should talk about that's all related? Another one, bursitis.
Yes.
We get a lot of women who've been diagnosed with bursitis. So a bursa is a little fluid-filled sac. Picture like a little pancake or something that's filled with lubricating fluid. You have bursas in many, many places all around your body.
Yes.
Specifically around your hips. One common one is hip bursitis. you can see that the protrusion here of the bone pokes out really close to the skin. There's a lot of muscles that attach right here, and there's various bursas, and this is a common spot where bursitis can take hold in the side of the hip. There's bursas, those fluid-filled sacs that are placed between some of the connections of the muscle to the bone to help lubricate or add to the slide and glide of the movement so that you don't end up with pain. What happens as you get imbalances in the core strength and the hip musculature is that the bursa gets smushed and pulled on.
That's that clicking and popping that you hear that we've talked about over and over, that grinding bone on bone. Well, that's the squish, squishing the bursa.
And it can get a pretty sharp pain. The bursitis is an inflammatory situation,
Yes.
so it can be a really strong pain. But so is it important sometimes to get what we call the spot treatments, the injections or the medications to get past that acute stage of these conditions? Sure, totally appropriate. But if you are the girl who doesn't want to be on that hamster wheel of, oh, now it's come back again, I need another injection, or oh, now it's something else. Well, now it's my sciatic nerve this time, or my piriformis is acting up now. Then you need to get to the root that's underneath the cause of all this stuff, which is an imbalance in that deep core strength.
And if you have questions about this, if this isn't clear about the imbalance that we're talking about, again, it's that up and in support. It's also pressurizing the proper pressure of your diaphragm working with your pelvic bowl. It's why we teach diaphragmatic breath work in the tools in our program. And you know, let's talk about the results that some of the women who have been diagnosed with these conditions have received with the program.
Yeah, it's like so powerful when you get the optimal, not having to think about it, firing of abs, glutes, pelvic floor,
hip rotators,
back
and
extensors, low back extensors, all coming on board with you for normal movement, which is what we teach through series of whole body movements. It is so powerful. You're going to feel the difference fast. And that's what our ladies love about it. And which is what we love about it too. It doesn't take but a few sessions to start feeling the changes. And within 30 days, it's mind-boggling how much better you can feel.
I mean, consistently across the board, women are floored. I would say they are really surprised at how much they are able to do without pain and discomfort that they couldn't do previously to starting the program. And this is in 10 minutes a day. I mean, we know this sounds too good to be true, which is why we did the research. It's why we put the low back piece, the low back protocol into our research, because all of the women that we were working with, despite what some practitioners may say that low back pain is not a part of these women health conditions, is just not true. Most of the women that we work with prolapse, with pelvic floor dysfunction, have back and hip pain.
And sometimes it feels the other way around. Sometimes
Correct.
It feels like, sometimes women come into us with the back and hip stuff, one of these, diagnoses. And then we start asking all the questions and they take the quiz, which you can take on our website, tightenyourtinkler.com, a 5-minute quiz that opens their eyes to realize, okay, I came here for the back and hip stuff, but
that's related to me peeing on myself?
I can't believe that's connected.
Yeah.
And are you telling me you can fix all this stuff at once, that I can fix all this stuff at once from my own home, on my own terms, and without having to put anything inside my body? Because a lot of women haven't addressed that stuff because they really would rather not go that route. And the answer is yes. And it feels so amazing to be able to sit here and confidently say that to you and know that it's true. And that is why we do what we do and show up here for you every week, because we can't wait to get this into the hands of all the women who we know can benefit from it. If that's you, send us all your tough questions. We are here.
Thanks, guys. We'll see you next week.